like to request Jamaica Torrejos to share her screen and unmute herself and continue with the presentation, please.
Good day to our esteemed colleagues, respected organizer, and fellow participants. We are deeply honored to be here today to share our insights on sustainable social urban growth, evaluating the effectiveness of population management program, family planning services in Valenzuela City. This presentation is a collaborative work prepared by us, and as permitted by our dearest organizer, we will be presenting together as three authors. So, to be led by Fabroa. Thank you.
Hi, good evening once again, everyone. So this is a presentation on our topic for sustainable social urban growth, evaluating the effectiveness of population management program, family planning services in Valenzuela City. Struggle is a defining feature of many large Filipino families who constantly overcome hurdles to meet the needs of their members despite limited resources. Mora 2014 emphasized that addressing population issues is a long-term solution to many of society's pressing problems. So in response, one local government in the Philippines, Valenzuela City, launched a population management program aimed at sustainably managing the city's growing population. So this study was thus conducted to evaluate the implementation of said program.
I will proceed with the presentation. So, the population management program in Valenzuela City is grounded in collaborative governance built on three key elements, which is first, principled engagement, where standardized procedures and strategies connects institution with communities for effective implementation. Second is shared motivation, sustained through interagency partnerships and collective commitment. And third is joint capacity, where institutions and communities work together to make services inclusive, accessible, and culturally sensitive. So these elements reinforce each other toward the goal of sustainable social urban growth. Next slide, please. Our study used a mixed method approach, surveys, interviews, and secondary sources. Data collection focused on three high-density barangays, Palasan, Pariancillo Villa, and Darpong. Secondary sources such as laws, ordinances, and reports provided context. Surveys captured residents' perception, while interviews with policymakers, implementers, and academics gave deeper insights. From this, we designed action plans to strengthen services, close gaps, and align the PMP with national and global frameworks like the Philippine Development Plan 2023 to 2028, the SDGs 2030, and Ambition Natin 2040. The program has had a clear impact. Free and accessible contraceptives paired with education on parenting and family responsibilities have helped reduce teenage pregnancies. Male involvement has also increased, although it is recognizable that more work remains to encourage shared responsibility. Residents affirm these benefits, rating the program 4 out of 5 for its effect on health, income, housing, and education. As one respondent shared, this program helped me become a better mother without sacrificing the needs of my own child. Such testimonies show that family planning strengthens not just individual families but also builds a nurturing environment for children. Survey results support this. 89.2% strongly agree that family planning promotes welfare, and 92.4% strongly agree on its overall effectiveness. Still, challenges remain. Services are strained in dense areas. Cultural and religious pressures discourage access. Misinformation and resource gaps, including staff and funding shortage, limit capacity. Gender roles restrict women's participation while stigma prevents open use. These issues highlight the need to strengthen education, inclusivity, and resources for long-term effectiveness. At the heart of our thesis is the idea that effective family planning services in Valenzuela City are made possible through collaborative governance. Principled engagement sets clear rules and safeguards dignity. Joint capacity ensures inclusivity, digital innovation, and youth and male involvement. And shared motivation integrates family planning with urban development and public health, empowering women, marginalized groups, and promoting equality. In short, family planning here is more than a health service. It is a governance model that sustains families, strengthens communities, and supports sustainable social urban growth.
Based on our findings, we recommend 5 integrated action plans to strengthen family planning as a foundation of sustainable development. First, to digitalize data systems to improve access and resource allocation. Second, establish regular feedback mechanism to address service gaps. Third, ensure consistent contraceptive supply through effective tracking and distribution. Fourth, standardize health services with clear protocols and continuous staff training. And finally, prevent early pregnancy through culturally sensitive education, youth programs, and health sexual seminars. So we conclude that sustainable societies begin with empowered families, supported with empowered families and programs. And to support this, services that are both accessible and adaptable to different needs. So that's all to our presentation. Thank you and have a great night ahead.
Thank you so much, team. So I will take the questions from our chair, Dr. Yarkwan.
Thank you very much, the team of presenters. I appreciate your concern and your research efforts towards addressing such a problem. These are not direct problems that you can approach from a one angle. They are multifaceted and oftentimes hinged on several factors, including cultural, level of education, so on and so forth. Now, you have mentioned PMP by family programming strategy or scheme. What don't you think the cultural perspectives will be an impediment towards the success of this project, given all the material needs and provisions? Do you think the cultural beliefs, cultural and religious practices, will that not be an impediment? Number two, other nations are looking for young-bodied people to service their economic needs and demands. When you arise in targeting population explosion, what's the predominant population in your country? I think that statistic would have been very important. Is the dominant population within the working age of, for instance, 18 to 60, 65? Are they in the elderly age bracket of 60, 65 and above? Are they in the children bracket of
Hi, Dr. And to all our panelists. Would like to answer the first question. So the first question, it was very evident in our surveys, in our interviews with the respondents in Valenzuela City, that cultural barriers are really huge impediments in the progression of this program. However, we also found out that their need or their want to sustain the needs of their family is more important than this cultural impediments or the religious beliefs that we so greatly held. For the second question,
So just add and to back up the answer of my co-author, population growth, we all know that sustainable social urban growth is about improving people's quality of life in cities and urban areas while ensuring that development remains fair, inclusive, and environmentally balanced. So when we align this to circular economy, the goal is to design urban systems to minimize waste, recycle resources, and regenerate the environment. In this way, urban areas does not consume resources, but also restore and reuse them, turning urban growth into a cycle of renewal rather than depletion. And for example, for applying circular economy in population management, urban planning means promoting energy efficient housing, waste to resource system, and even sustainable transportation. So these measures reduces ecological pressures while improving social well-being, ensuring that population growth does not compromise future generations. And for the indicators of our population management for the surveys and for the key informants, we have measures population dynamics, social welfare indicators, environmental equality, equity inclusion, and economic stability of every families and household within the population density of our target area. That's all. I hope we answered the question of the dearest audience or listener. Thank you.
So thank you, team, for answering the question of Dr. Yarkwan. So I want to ask Dr. Yarkwan if he is satisfied with the answers or if he has more questions.
Well, thank you so much. I was expecting statistics to come forth that this is the age bracket or the population by age bracket classification based on the national statistics that was carried out. For instance, China is aggressively, or other countries might be pursuing the population growth now, like Canada, for instance, that has a heavy aged population. So they have focused their immigration programs on attracting young men and women who can work for them. In the Philippines, you are advocating for family planning, which is very good. But do you look at the overall impact of that on the Filipino economy over time? Is it that they have a bloated working class population that needs to be trimmed down by suppressing the emergence of the younger generation? Is it that why? In other words, I'm asking, what is the rationale behind this work? Is it really justifiable? Do you have numbers to support that, please?
For the specific question of Dr. Yarkwan, the specific age in wherein the Philippines wherein is most prominent in the Philippines. We don't have the specific number for that in the paper, but the prominent age in the Philippines is the working age. The rationale behind this is because since the Philippines is a very poor country, many families, many parents cannot support their own family because there are stigmas. Although population management program is very accessible, since then it has been going on for 11 years. The lack of the initiative of the government then to push forward this program has led to the people being reluctant to take it, and now that they're taking more measures to encourage families to use it, especially if they cannot sustain families. Especially if they cannot sustain families, has helped them to limit their family size, and that is really the purpose of this study, to provide choices for the poor families, that there are contraceptive methods that they can use, that they should not be afraid to use, because it is a must for their family, for their homes to have a nurturing family, and technically, like, generally a family that can support them. Thank you.
Dr. Yarkwan, do you have any other questions?
Thank you very much. I appreciate your contribution. Just as an input further to your research group and all colleagues out there, such kind of research work is very important to premise them on data. When you have strong data backing what you are doing, it gives you the push to carry on and to say, hey, this is the numbers on ground, and these are the kind of things that if it is done, we either lower the curve or improve the curve based on what the government is projecting and targeting. Thank you very much.